What do you tell those who are just starting out or just getting ready to do their health tech startup?
Yeah, I'll give my macro perspective and then kind of what I give individual advice around, because I do see more and more healthcare early stage CEOs coming to me asking me questions like this. And I think the challenge here, Bill, sadly, is we've invested a huge amount of money into healthcare. I mean, it's kind of staggering. I know it's in the tens of billions. It's a massive number now. Something like 7,000, 8,000 startups is the last time I looked at data from Startup Health on the statistics. And I sort of sit here and say, have we really made a dent? And I don't think we really have. And I think the reason for that is everything that worked in other industries in terms of technology coming in and improving things and driving efficiency just doesn't work in healthcare. And it's really due to, for lack of a better word, the rationality of healthcare. And I think that's probably, for me when I started and for new people coming into this space, you have to really understand the incentives and the value chain you're in. And I don't think enough people spend enough time early on saying, I'm going to deliver value here and who's it accruing to and who's going to pay for it. We tend to rush to consumer-driven experiences, but again, even in high consumer-driven plans, you still have your employer who's covering some of the cost, or still in a lot of cases, a lot of it on the commercial side. And then you got complexity with providers and where they are and their technology. And so I just think that was one of the hardest things for me. If we sat down and I tried to lay out for you the pharmaceutical industry and the pharmaceutical value chain, it's incredibly complex. Yep. There's wholesalers, there's PBMs, there's providers, there's payers, there's retail pharmacies, there's specialty pharmacies, there's Medicare, there's Medicaid, there's commercial, right? All these things you have to kind of continue to rationalize. And I think that a lot of early stage startup companies miss that and miss the target in terms of who's accruing what value and when, and then how do we fit into that value chain from a service or technology perspective.
Yeah. That is such a great point. So many startups, I have that conversation and I say, okay, what's your economic model? Who's going to pay you? And they say, well, these people are going to pay me. I'm like, have they ever paid for this before?
No.
Well, no, but now they're going to pay for it. It's like, no, they're not.
Yeah. Yeah, it's just wild, and I see the same thing where, and I think one of the things that we've done, and I think this is so true, is that we spent so much time focusing on the consumer, and we've come to this conclusion as a company: any prescription decision or any decision, prescription or otherwise, is made by the provider.
Yeah,
it's not made by consumers, and consumers are really. I mean, I consider myself a relatively well-educated guy, and I don't know how to sort out what is the right decision for me. I mean, I need a doctor. And so we've really had this heavy focus, and I wish there were more startups focused on the point of care, the provider experience. We've spent so much time trying to get to the consumer unsuccessfully, and I don't think we've moved the dial enough versus what we could do with the provider. I think of Atul Gawande's, I think, quote. He says, the most expensive medical device is the pen, because the provider, not that that's true anymore with EHRs, but they're writing all the orders. And I think that's such a great quote. And I think about that often because this is so much, I think cost transparency, otherwise it's really about helping doctors make the most informed decision for their patients that's cost effective. And that's where, we think the market's going overall.